This is a plain CT scan abdomen and pelvis of a 45 years old female patient. Her hysterectomy and bilateral salpingo-oophorectomy was done. Immediately postoperatively, the patient developed fluid collection in lower abdomen and pelvis. Ureteral injury was suspected, so DJ stents were placed on both the sides and the patient was catheterized. Few days later, the patient started passing urine through vagina. This CT scan was done to localize the site of and side of the ureteral injury. This is the immediate scan. This is a fluid collection here in the pelvis. Soft tissue density shadows are present in its posterior part. These show significant enhancement and are suggestive of being most probably the granulation tissue. This is the urinary bladder. This is Foley's balloon. These are the DJ stents. This is the delayed scan. No contrast medium is seen in the urinary bladder or in this fluid collection here. This is a still delayed scan. Still no contrast medium has entered this fluid collection here or in the urinary bladder. This is the scan which was done about 20 minutes later. Now please follow this ureter. Now this is the site of left ureteral injury. From this, the contrast medium has leaked and has entered the pelvic fluid collection. Now this is the vagina which lies posterior to this connection. These are the streaks of contrast medium in vagina. Small amount of contrast medium is present in the urinary bladder. Now this is the vagina. So in such cases where there is a strong suspicion of the ureteral injury, one must keep following the patient and do repeated scans to outline the ureteral injury. This CT scan was done about an hour later. Large amount of contrast medium has entered this fluid collection here. Urinary bladder is filled with the contrast medium. Now this is the vagina here. Contrast medium is present inside it. So there was ureteral injury, there was collection of fluid in the pelvis, and later the cervical stump or the vaginal cuff, it just sloughed out and the patient developed communication of vagina with the urinary collection in the pelvis. So the key to success in such investigations is that whensoever there is a strong suspicion of ureteral injury, one must keep following the patient and do repeated scans.